There's always somebody in the family who takes care of the elder parent, the sick child, or the cousin or the grandparent. But what happens when that person gets tired or needs a rest? Stay with us for this segment of Kentucky Health and find out.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about caregivers. In particular, what happens when that person who's responsible for providing care to a sick individual, be it a terminal cancer patient or someone who may have mental illnesses, or something such as Alzheimer's disease or other chronic illnesses, gets tired or is not able to really do things for themselves. What do we do to provide support for that individual? And we all know who these people are. They oftentimes may be a grandparent, a parent, or maybe a young child that's in the family that has been that person who's designated to take care of everybody else. So let's find out what goes on when that person needs support. And with us today we have two guests, Dr. Karen Robinson, who's a professor in the School of Nursing at the University of Louisville, and also is director of the Volunteer Caregivers Program at UofL. Yes. Thank you for being with us today. And then we have author, Ms. Janice Baldon-Gutter, who wrote the book, Caregiver, A Daughter's Story, Life After Loss, Surviving Caregiving. Thank you for being with us today, Janice.
Thank you for inviting me.
Now, Karen, let's start off with, I guess, some simple terms here. What is a caregiver?
My research and practice has been specifically with caregivers who are taking care of someone with a disease like Alzheimer's disease. The term that often is used is dementia, and dementia is a common umbrella term. There are many different diseases that fit under it, and Alzheimer's is the most common. So my expertise is specifically for caregivers of people with dementia.
So what are you talking about? Are we speaking about family members? Are we talking clergy? Are we talking healthcare workers, or what?
We're talking about everyone because everyone comes in contact with caregivers of people with dementia. And the statistics are that 1 out of 4 people in our population, in our viewing audience, will be affected by somebody with a disease that causes dementia. And related to dementia, it's a population that is affected by aging. So the highest risk factor is aging. The older you are, the more likely you are to have a disease that causes dementia. For example, by the time people are 85 years of age, 1 out of 2 people have some form of dementia. So the real problem is that our population is aging, and especially the baby boomers are aging. And so in the future, unless we can find a way to stop Alzheimer's disease, for example, this will be a public health dilemma because there is no way our society can build enough beds to take care of people with dementia. And so therefore, it's very important that our population understand caregiving and how to take care of themselves if they are caregivers.
Janice, let's go to you. How do you see this term caregiver?
Well, in terms of caregiver, I look at caregiving from the aspect of the average everyday person. The average everyday person, not a healthcare clinician, who faces this, all of a sudden they get a telephone call and mom and dad or aunt or someone is ill. So I look at it from the aspect of the average everyday person who gets that telephone call and all of a sudden they are thrust into the role of being the caregiver. The roles change. You're no longer the daughter that you used to be. Now you are the caregiver. And the balance between that and the shock of that from the average person is pretty phenomenal. And I went through that, and I see a lot of my friends going through that same process, and I wanted to help them go through that process. It's behind me now, but I saw so many of them going through that I wanted to do something to help, to bridge that gap. I saw many healthcare clinician books on caregiving, but I didn't see it from the average everyday person who wakes up and gets that telephone call.
Mm-hmm. You know, it seems to me that we talk about the sandwich generation, where I think we're all about the same age, where you have elderly parents, then you have us, and then children, and then even grandchildren, where that person in the baby boomer is sort of like in between trying to care for things. Is that a common problem or a common situation that we're seeing nowadays, or is that more of a cliche?
When you look at families, you can predict who will be the caregiver. And most often, if it is a parent, it will be, first of all, a spouse. If that parent has a spouse, then that spouse is usually the first caregiver, often called primary caregiver, and then the adult children are supportive of that spouse, because if something happens to that caregiver spouse, then the adult children will have to step up and provide care. If there is not a spouse, then it's most often an adult daughter. Often it's the oldest adult daughter, it's the adult daughter that has a profession in caregiving that knows the most about health care. And often it's amazing that that adult daughter has no idea that her family views her as the caregiver. So for the audience out there, it's good to have a conversation about, if something happens to mom or dad, who is the caregiver? So be aware that my own research finds that nurses, social workers, healthcare professionals are viewed as the whole family just assumes they will step up.
What was your situation, Janice?
Well, in my situation, I wasn't the oldest daughter. I wasn't the youngest daughter. I was I guess the responsible person, especially for my mother. My mother had a limited sized family here in Louisville. My father had more family here, and I had much more help because he had a larger extended family than I had with my mother. I also want to say that caregiving can happen really at any age. You talk about the boomer, and I went through it many years ago. So really is an age specific, and many times it's just the one that people feel that can handle the responsibility or has the time or whatever, but it can just happen at any time. So with me, I was my mother's daughter. I was the only daughter of my mother, and it happened. I got the call.
So having been the it person, did you recognize that this was happening, that you were the person who was going to be responsible for providing the majority of care? Or was this something that you wanted, or just, hey, it just kind of worked its way out that you were doing all this?
I always knew, especially from my mother, that I would probably be the primary. As a matter of fact, I delayed some career decisions to stay locally in Louisville for that reason. So I always felt that, at least for her, I would be the primary caregiver. But for my father, of course, there were other children, and we shared in that responsibility. I led it, but I had much more help.
Now, let's go back to your particular area of expertise, Karen, when you're talking about the Alzheimer's patient. Now, this is a person who has good days, has bad days they may not even know that it's a day going on. That presents a special challenge to the family, I would imagine.
Right. Upon becoming a caregiver, it's very important that the primary caregiver and as many family members as possible learn about the disease, because there are special disorders that happen with people with dementia. And one is cognitive deficits. They can't remember. And so because they can't remember, they have very troublesome symptoms that can really aggravate the family and caregiver. And the caregiver needs to understand that these are symptoms of the disease. For example, in people with dementia, they repeat the same question over and over because they can't remember that they've asked it. They also have problem behaviors where they're very paranoid. They can't find something, and they don't understand they have any memory loss. Nothing's wrong with them. So therefore, it must be the family that stole it. They can't find their billfold, so you, my caregiver, stole it. And the family and caregiver need to understand these are symptoms of the disease. This is not deliberate behavior. And in my own practice and research, this is one of the biggest causes of burden for caregivers. They don't understand the disease and they think this patient is doing this deliberately to aggravate them. So education is so important in working with caregivers. It's important that they use community resources. In my example, we've been very fortunate that the Alzheimer's Association is here and very active. And throughout the state, there are support groups that people can go to learn about Alzheimer's disease. And also they have educational sessions. So I would really encourage people to use support groups and informational sessions about whatever the disease is. Cancer, usually there's a cancer support group. So seek out information about your disease because it will have individual symptoms that you're going to have to deal with. And you need to understand what is disease and what is not disease.
Yeah, go ahead, please, Jen.
I cannot elaborate more. I look at caregiving from the general umbrella aspect, not just Alzheimer, caregiving, period, whatever the situation is. And what Dr. Robinson has said is so phenomenal because one of the things I talk about is, number one, educate yourself on the condition, whatever that condition is, of your loved one or of your caregiver. That's part of your responsibility to ease some of the burden. Because when you go to see the healthcare professional or you go see the doctor, if you have educated yourself on the condition of your loved one, it will help with the dialogue. It will help you to participate in the care rather than be dictated to about the care.
Now, I must admit, one of the things that's frustrating for me as a clinician is to have a family member come in and there really isn't anybody else with them. It's hard to identify what that support structure is going to be, and or the opposite is going to be different people outside will suddenly call in, yet there's no coordinated activity. So how did you try to coordinate things or work that sort of situation out during your process?
I went to the doctor with my mother. And I established, number one, I changed doctors and put my mother under my doctor.
Now, why'd you do that?
Because I trusted my doctor.
But she had a relationship with this other person.
No, she really didn't.
Oh, okay.
And I didn't have a relationship with her doctor, and I wanted someone that I could trust. So I took her from her doctor to my doctor, and he was wonderful. He understood. Plus, I educated myself on her condition, and we went from there. And now it's even more difficult with the HIPAA laws, privacy laws, which weren't in effect back then as much.
Of course, HIPAA laws referring to what things a physician can and cannot talk about, Privacy and Portability Act that was put out. So we're talking about what things people can and cannot talk to. So I'm sorry.
Correct, and it's vitally important now
Yes.
that when you go to the appointment with your loved one, so when you go from phase 1 to getting all these things initially set up to phase 2, where you're actually in the caregiving phase, you have to have all these things straightened out and signed so the doctor can share information with you. So that's vitally important now. So I transferred my mom to our doctor, and he helped coordinate the care and worked with me phenomenally.
Karen, tell me about the Volunteer Caregivers Program. How does that work?
This is a program of research that we provide interventions of support and education. And in order to be involved in the Volunteer Caregivers Program, you do have to have a diagnosis of dementia. So, and we can help you get that diagnosis. We can make referrals if a family does not have that. But primarily we provide an assessment looking at what the family and the main caregiver knows about dementia. We identify what problem behaviors exist and how upsetting they are to the caregiver. We assess for burden and depression, and we follow with a care plan. We individualize the education and information according to whatever problems they're having as a caregiver and family. And whenever we provide education, we encourage the caregiver to invite all their significant others and all their family. Because we have found, particularly caregiving for a person with dementia, can cause a lot of family conflict.
Now wait a minute, you said depression. Now, are you speaking of depression in the caregiver or depression in the patient?
In the caregiver.
Interesting.
My own research finds that 50% of caregivers of people with dementia have depression. And so family members need to be aware of the signs and symptoms of depression and get that caregiver evaluated clinically, because it's very treatable.
Yeah, but suppose somebody goes through a program like yours. Are you seeing any benefit from being involved with the Volunteer Caregivers Program?
I was just recently examining outcomes of our program.
Can you talk about it?
Yes, I can go on record.
Okay.
Our program has significantly reduced caregiver depression, and that's a very significant finding, because when caregivers are depressed, they are immobilized. That's one of the symptoms of depression, is you feel hopeless and helpless and you can't do anything. So it's very hard for that kind of caregiver who's highly depressed to make decisions or to seek help. So it's very important that the supporting family identify signs and symptoms of depression and get them evaluated and treated.
Is this program throughout all of Kentucky?
That's a good question. With funding, we could be all through Kentucky. Currently, we will travel 45 minutes to do an evaluation and assessment, but caregivers throughout the state might be able to drive to us. So certainly, we can evaluate anyone.
Well, maybe as the state is being carved up by UofL and University of Kentucky and other private groups, we can find some money for that. Tell us about your journey and what's in your book.
Well, first of all, I'd like to say I wish this program had been in existence. This was 9 years ago when I did my caregiving, and it is very much needed. How it started, well, what's in the book, I go through 3 phases of caregiving. Phase 1, prepare. Mom, dad are dancing and happy now, but now is the time for you to take care of these issues. It's difficult to approach, but in phase 1, it's preparation. Get prepared. Then I talk about phase 2 of caregiving, and that phase involves you're in process. You've gotten a telephone call, the call has come, mom is ill, you're in the hospital. But if you do what you were supposed to do from phase 1, preparing, going to the doctors, getting all the documentation, then phase 2 is a little easier. And well, it's never easy to see a loved one ill, but it's a little easier because you can concentrate on their feelings and yours if you've taken care of some of the administrative details in phase 1. Phase 3, I talk about living life after. Normally, unfortunately, I hate to tell people this, but caregiving ends normally when there's been a death. And that is reality. It's very rare that someone would say, oh, you've been caregiver for 2 or 3 years, now it's my turn. Very rarely will that happen. Very rarely will that happen. So you also have to learn how to take care of yourself during the phases of caregiving, and so that you can survive and move on with your life. And when she talked about depression, I went through all those phases. And at one point I was saved by one of the social workers at the nursing home. Mom was in a nursing home for a year before she got out and was able to live on her own. And the social worker there said, okay, we're going to take care of your mom, but I want to see you once a week.
Yes, yes.
Okay, and that was before all that, and that was phenomenal because mom was angry, and she was angry at me because she was ill. Yes. And so had it not been for that social worker, I don't know where I would be. And I'm a pretty strong-minded person, God-fearing, spiritual, but I was depressed and the stress. And she helped me through that and helped me help mom. Mom was able to get out of the nursing home and live 3 more years on her own, wonderfully. Well, I say on her own. I was there every day. And before she died in 2001. I also had both parents, both of them died in 2001, within 2 months of each other. Mom died in September, dad died in November. So it was a phenomenal period. I would never have guessed that they both would have been ill at the same time and gone so closely together. But because of the counseling and the help that came into my life during that period of time, I was able to survive and move on.
Let me ask you, irrespective of whether or not you're taking care of an older parent or you're taking care of a child, is it okay to be angry sometimes?
Sure.
It's okay.
Yes, yes. Caregivers go through various phases of grief, and anger is a big stage in grief.
So frustration is expected.
On both ends.
On both ends. I was interested in the way you said that. Mom was angry because she was ill, and here you are. Do you think there was some resentment on her part for having to depend upon you?
Oh, definitely. And there was some
That's not an uncommon thing, is it? I mean,
no. And there was some resentment on her part because I had to make some decisions that she didn't like, that were in her best interests. Spiritually, you know, I prayed and made those decisions. So she was angry because she was ill and dependent. She was angry because of the decisions I had to make on her behalf. But we were able to work through that with some counseling.
We used to always, part of morbid humor as a resident, but just when you had someone who you knew was going to die and the question about continuing support, and everybody was in agreement to say, we're going to let mom or dad go comfortably, there'd always be somebody who would show up at the last minute and say, no, wait, let's do everything, totally seemingly out of proportion of what the situation would call for. How do you handle that one?
End of life is very difficult for families, and rather than waiting till the end actually comes, families need to have these conversations early in the disease stage, particularly in dementia. As soon as that diagnosis is made, they need to hear what the patient wants as far as end of life. What does he want? A lot of intervention at the end of life, or what does he envision? Who does he want to take care of him? What does he want as far as nursing home or not? Or you need to get his ideas about end of life. And then actually when you get to end of life, one of the very best referrals is hospice. And hospice provides a lot of support to the family. They have an interdisciplinary team, including a chaplain, and they can help you access all different kinds of holistic type referrals to help pay for home care and respite and so on.
Well, that goes back to what I was talking about in phase one. If you make that plan, this is what we're going to do, pull the family together and say, this is what we're going to do. That when you get to that final stage, it's easier. I won't say that everybody always cooperates or remembers, but at least you have made an attempt in that phase one to outline these things in that early phase.
Tell me about some of the documents that we need to have prepared.
Wills, trusts, know where the insurance policies are. And I say in part one here, now make sure you're doing that with the purpose of administrative details. You know, you have to know where these things are. You don't necessarily have to know in detail what's in them, and you're not doing it for personal gain. But have all these things in order. The healthcare surrogate forms, the I can share information, HIPAA forms. Phase one, just know where these things are in the planning stage. Because when you get to phase two and you're running to the hospital and you're talking to the doctors, you're going to be so emotionally tied up that trying to do phase one and phase two together is very difficult. It's very difficult. So I advise everyone from the average person's viewpoint, get your plan together in phase one.
Get the plan together. Yeah, it's interesting. As a physician, we look at it in terms of trying to care for the patient. We want to take care of their disease, and if we can't cure them of their disease, make the patient more comfortable. But when we talk about it, there's more to that in terms of making the people comfortable, and that's incorporating the family's responsibilities in the care of the patient, what the patient's needs and or wants are. And as we're getting down more and more, it sounds like to smaller and smaller families, more and more duties are falling upon fewer and fewer people, so there's burnout. Tell me, how does someone get in contact with Volunteer Caregivers Program?
Call the UofL School of Nursing. Their number is 852-5825, or directly call the Caregivers Program itself, 852-CARE, just C-A-R-E, but it's 2273. And of course, that's area code 502.
How do we get your book?
Caregiving A Daughter Story is available at Borders on Bardstown Road. It's also available by request at Amazon.com and Borders.com. And I have a website, www.caregivingadaughterstory.com. One other thing I want to point out.
I'm gonna have to stop you because I want people. I want to make sure that people sit down and talk to their family members, and let's work this out and find out who's going to be in charge. Thank you for being with us on this segment of Kentucky Health. You feel free to contact us at KentuckyHealth@insightbb.com. I'm Dr. Wayne Tuckson. Karen, Janice, thank you both for being here.
Yes, thank you.